Healing after surgery, bone healing begins right after surgery. It needs to be protected initially as this is relying fairly heavily on the fixation used, usually screws. If you overload these enough times, these screws can break. So initially what I do is have you be toe touch weight bearing for 6 to 8 weeks, followed by a progression to full weight bearing over the next 6 weeks. Easing back on that if you have significant pain or discomfort while healing occurs. During the recovery time, it's important to move the hip, so pool therapy and stationary bike are the best that I have found. Pool therapy, you're walking in the shallow end, sidestepping in the shallow end. Stationary bike, really gentle pedaling, using the opposite leg for propulsion, mainly just following along with the surgical leg is also really helpful. Gentle stretching of the leg is really helpful. The initial recovery after surgery is important to concentrate on reducing swelling and inflammation with ice and elevation. So ice over the front of the hip, elevating the leg on 3-4 pillows with the back down flat is helpful to bring any fluid out of the leg and promote healing and reduce inflammation of the hip, which can be a fair bit after the surgery the first week or two. So ice and elevation are critical. Then you get up using your walker or crutches slowly, and initially toe touch weight bearing, getting around, relying fairly heavily on your walking aids, and reducing the risk of falling with where you walk, where you are is critical. Complications of surgery, infection, blood clots are always risks with this surgery. We also worry about neurovascular structures. This is a procedure that is quite invasive. It comes close to some very important neurovascular structures, front and back of the hip, and it's important obviously to be conscious of these to minimize the risk, but you're exposed to the risks of injury to these structures with this surgery. Risks as well include delayed or non-union of the bones that we release. Particularly the front of the hip is an area that can be quite difficult to heal in certain patients, particularly when we have to do a large correction to achieve proper coverage. So protecting the hip and using your crutches and progressing with weight bearing gradually is quite important to reduce that risk of failure of bone to unite. Arthritis will progress at some point after this procedure. The purposes of the surgery are to reduce pain and slow the progression of arthritis, but this can still proceed at a certain pace later in life.